Mistake for the CDC when rolling out the boosters across the board to say that, to not necessarily recommend that you have to get it or that even that you should get it, but that you may get it?
Yeah, look, they said should for 50 and above, so they've walked the age down. I think it shows the challenges that the agency has making decisive decisions in a setting of a crisis. But this also reflects a broader ambivalence in the public health community about whether these vaccines should be used as tools to prevent people from getting severe infection and hospitalization and succumbing to COVID, or whether they should also be used as tools to try to control and perhaps end the pandemic. And if you're in the camp that these vaccines could be effective at trying to control and maybe even end the pandemic, then you would advocate boosting younger people. If you're in the camp that these vaccines should only be used to try to prevent severe outcomes, then you're in the camp of only boosting older people, because the younger people, people in their 20s or 30s who are fully vaccinated with 2 doses, probably have more residual protection from those 2 doses than a 60 or 70-year-old, and they were at lower risk to begin with from a bad outcome from COVID. So it depends on where you break down, and you're seeing that debate get reflected and play out in the CDC's sort of stuttering approach to how they've rolled out the recommendations around the boosters. They've kind of, incrementally towed into this.
Scott, that's a big part of the problem. That's the question I was going to ask, too, is we're telling people now, just before Thanksgiving, to go ahead and get it. We've kind of missed the boat. We've missed the idea that there's been a pickup in this. And if you're in the camp that says, look, we don't want to give this to younger people because we don't think it's necessary, we're just trying to prevent hospitalizations, okay, then you should also be in the camp that says those people who are younger should be taking protection so they're not spreading it. But you can't be in both camps unless it's completely illogical. Either you think you should get boosted so you can go out and go back to your life as normal, or you think, okay, don't worry about it at all. I don't get it.
Yeah, look, these are the challenges. We need to make these decisions at a population level, and it's hard to sort of parse the population by specific age camps. The administration, the political leadership in the administration, seems to be firmly in the camp that these vaccines should be more broadly used to try to bring an end to this pandemic. So I think that they're in favor of having broad eligibility and a simple construct. We didn't really see that from CDC. I mean, it's simpler than where it was before. But as Andrew pointed out, the should is only for 50 and above. We didn't completely miss the window. We're late to this for sure. And you're seeing what's happening in Israel with the dramatically declining case rates because they got their population boosted. We still have an opportunity to do it because the effects of the booster are pretty much immediate. I mean, the data on the decline in clinical cases is about after a week. But if you look at the antibody response, it's almost immediate. So people who go out and get their boosters now could have substantially more protection in time for even Thanksgiving. And also the effect of the first dose in children is much more robust than the effect of the first dose in an adult. So even if you get your child a first dose right now, they're going to have more immune protection than a comparable adult would just from that first dose. So there's still opportunity to get more immunity in the population that could be protective in time for the holidays.
Scott, is there any possibility that the immune system could eventually say, okay, I got it. I got it. I need to be ready for this. I mean, is there a fourth? Will the third one be? Will you be okay 2 years from now having the third booster, or is there going to be a fourth booster? Is it possible for the immune system to say, okay, my T cells, I've seen this enough. You don't need to give me any more boosters?
Yeah, look. The flu vaccine lasts 6 months. I think this vaccine is going to last substantially longer than that. We don't know what the durability is going to be after this third dose. It's probably going to be different for people of different ages. And then you run into the complexity. Do you have different recommendations for older people versus younger people? I suspect that younger people are going to have a more durable response from this third dose than older individuals. This may well become an annual vaccine, at least for some portion of the population. And then you run into the question that Becky raised. You have a broad recommendation that it's just an annual vaccine for the simplicity of administering it. These are going to be questions that we have to get worked out and that CDC is ultimately going to have to make a policy call on. But first, we're going to have to see what the durability is from this third dose. We don't know. We'll have data coming out of Israel. We'll start to see whether or not there are declines in the immune protection, at least in the antibody response. We don't know what the cellular immunity, how durable that's going to be. If I had to guess, I think it's going to be highly variable. Younger people are going to have a much more durable response than older people. And for some portion of the population, older individuals, immunocompromised people, this may well become something that's done on an annualized basis.